Hi everyone, Tam here from Yogaphysio, and it's day 3 post my hemithyroidectomy. So I've just gone through some breathing similar to what we did on day 1, and I just want to come back down to the floor for a minute just to show you how much easier I'm moving and how I've been able to extend some of what I've been doing. So I can get down quite easily now. And the movement I wanted to show you is this twist side to side. If you remember day 1, I couldn't get my knees all the way down. So this is really nice, a nice way to mobilize the neck and the thoracic area without moving my head, although I am moving my head a lot more easily today, you'll see. So in fact here I could even turn my head a little bit in the opposite direction. And it feels nice to have a pause and take some big breaths. It's really important to keep the rest of the body moving really well. Keep the energy flowing. And I might even be able to today take out, yeah, look, I can actually lie flat today, which is great. Just getting that little bit more openness in the front of my throat. Oh, that feels good, and that means I can get my arms overhead a bit more, and get this stretch out through this tight pec minor that often troubles me. Taking big breaths up into the upper side of the chest. A little click in the back there that will no doubt feel better. So you can see I'm moving much better. I've done a long walk again this morning and came back and had a little rest. But yeah, what I've been reflecting on today actually is just how pain really guides us to know, really listen to our body without any filters. Our body tells us how far we can go. So sometimes filters kick in. I mean, I know this from being a physio working with pain, that there's filters that override our listening to the body. So first of all, there's the filter of pushing ourselves, of, kind of wanting to do more than our body's ready to. And that way, particularly in these acute stages of injury or, post-surgery, surgery is a kind of injury to the body. In these early stages, if we push the body too much, we disrupt the healing process. So, first of all, if I'm listening to my body, I'm not going to push my body too far. And you can see the difference between yesterday and today in terms of how easily I can move my neck. And, at day 3 today, there's really strong healing tissue there that's actually mending up. And just incredible how the body does that. So in the other direction, what can happen is that we avoid movement. We get a little bit fearful. We have a fearful filter. And that can prevent us moving enough to actually support the body's healing. If we don't move enough, the scar tissue that's forming inside my neck is going to be a little bit more like a Brillo pad. It's going to be a little bit disorganized and not so strong for the movements that I require my neck to do in the long term. So, my pain allows me, it guides me to know how far to go. And that way, all the fibrous tissue that's starting to accumulate, knitting those ends of the tissues together, is going to be doing so in the lines of stress. So, I require my neck to move in all different directions. Then if I'm starting to move within my pain limits, that scar tissue is going to be aligned to meet that stress. So yeah, that movement's a really important part of healing. And this is relevant not just to, you know, the surgery healing. I mean, this is a knowledge that I use, you know, in working with anyone that's had an injury, anyone that's had disruption of any tissues needs to know, you know, that they can listen to their body and that movement has a really important role in their healing process. So I'm just going to come back to hands and knees and just check and see how much more movement I can easily do. And my neck's really feeling much, much freer. And I haven't had any painkillers today. I don't think I've had any painkillers now since yesterday, maybe yesterday morning. So, you know, it's not, I'm not getting pain per se, but there's just a feeling of sensation there that I know to respect. Of course, if pain's kicking in, you know, if the tissues are more innervated, there might be more pain. If you're, you know, had a similar, an injury or maybe neck surgery, could be a little bit more painful. But, you know, I can certainly feel the limit of the range, but you can see it just gradually is growing day after day. As the tissues get stronger, my body's able to move that a little bit further. So anyway, I'm gonna keep this program up. Maybe maybe I'll do this again before I go to bed tonight. Breathing still feels really important. The breath is providing movement up into this area, getting energy flowing up into my lungs and up into the muscles around my neck. Anyway, we'll see where we are again tomorrow, maybe. Okay, that's it for now. See ya.